This talk is about how to counsel patients about psychiatric medications. Based on my clinical experience and patient education sources, I'll distill the most important concepts you should counsel patients on when starting a psychiatric medication. To demonstrate these concepts, I'll walk through an example of how to counsel on escitalopram. These concepts fit into the categories of benefits, risks, alternatives, administration, monitoring, future considerations, and financial considerations. For benefits, you should counsel on the indication and whether this indication is on or off label, expected benefits, and how the medication works in simple, patient-friendly language. For escitalopram, on-label indications include MDD and GAD, expected benefits include reducing depression and anxiety symptoms, and it works as a selective serotonin reuptake inhibitor. In other words, it helps restore a healthy balance of the neurotransmitter serotonin in our brains, which is responsible for regulating mood, sleep, appetite, and other symptoms seen in depression and anxiety. For risks, you should outline side effects, including common side effects, rare but serious side effects, irreversible side effects, and effects from long-term use. You should explain any black box warnings, and you should discuss any potential drug-drug interactions or any interactions with the patient's other health conditions. For escitalopram, common side effects include nausea, insomnia, and sexual side effects. Rare but serious side effects include serotonin syndrome and hyponatremia. There are no known irreversible side effects or negative effects from long-term use. Escitalopram carries a black box warning for suicidal thoughts and behaviors in pediatric patients. Some drug-drug interactions include with MAOIs, linezolid, and methylene blue, and there are particular risks associated with escitalopram use in pregnancy and certain cardiac conditions that should be discussed. Next, you should discuss alternative treatment options, including alternative medications. For escitalopram, alternate medications would include other SSRIs and other types of antidepressants such as SNRIs and atypicals. Alternate treatments include psychotherapy and lifestyle changes, such as modifying diet and exercise habits. Next, discuss how to administer the medication, including how to take it and practical guidelines such as what to do if the patient misses a dose and any necessary lifestyle changes. For escitalopram, it should be taken once daily by mouth. If a dose is missed, recommend taking it as soon as the patient remembers, unless it is very close to the next dose. Treatment guidelines recommend avoiding alcohol use while taking escitalopram. Monitoring involves both any necessary lab monitoring and symptom monitoring to determine response and remission. For escitalopram, there is no lab monitoring required. To monitor symptoms of major depression, you can use the PHQ-9, and to monitor symptoms of generalized anxiety, you can use the GAD-7. Future considerations include how long the medication will take to work and how long the patient will need to take the medication. Although decisions on when and how to adjust the medication dose should be made with your guidance, it may nevertheless help to counsel the patient on the target dose, expected schedule of dose increases, and how to eventually decrease and stop the medication if indicated. It can also be helpful to counsel the patient on next steps should the current medication not achieve the desired treatment response. For escitalopram, patients can expect initial benefit in as early as 1 to 2 weeks, but it may take 4 to 6 weeks to achieve maximum benefit. For a single major depressive episode, treatment should continue for at least 6 months after remission, but longer treatment durations may be recommended depending on a particular patient's disease course. The dose is gradually titrated every 2 to 4 weeks until response is achieved, and if it needs to be stopped, should be gradually tapered over at least 2 to 4 weeks to avoid uncomfortable withdrawal symptoms. If escitalopram does not achieve the desired treatment response after an adequate trial, next steps include switching to an alternate antidepressant, augmenting with a second antidepressant agent, or adding psychotherapy. Finally, financial considerations include the expected cost of medication, insurance coverage, and if prior authorization is required. Escitalopram is generally low cost and covered by most insurance plans, and prior authorization is usually not required. That's the end of this talk. I hope this helps in organizing your thoughts around how to counsel patients about psychiatric medications. Thank you.